Hello everyone, myself Nikita Gore and my today's topic will be the gangrene. So what is gangrene? Gangrene is a macroscopic death of tissue with superadded putrefaction. Okay, necrosis is a condition in which there is a death of cell, but it is a gangrene, means with superadded putrefaction there is a macroscopic death of tissue. So it is a very serious entity or serious disorder in which there is a means if the patient is diabetic, particularly the risk factor is for diabetic patient. Okay, so patient is diabetic, so there is a increased sugar in his or her blood. Then in that patient, if we get trauma or any type of injury, penetrating wound and anything on his, particularly on the limbs, then there is a sugar. So sugar is a very good medium for bacteria to grow, so there will be a growth of bacteria, and in that condition it get putrefacted. Okay, due to bacterial infection, in this wound will be putrefacted. Blackish appearance will be there, from purplish blackish appearance. Then affected parts will be cold. So these type of symptoms will be seen. And if get it worse, in first stage we can cure it by homeopathy, either allopathy. But in allopathy, if it is a large stage gangrene, okay, means it get worse, then in that condition, in that diabetic patient, you have to remove that part. Okay, surgery you have to perform the surgery, that is to remove that part completely. So in the first stage you should consult. Okay, you should prevent from it getting infected. So we'll see what are the etiologic factors which are responsible for this type of gangrene. So secondary to arterial obstruction, these arteries get obstructed due to many conditions such as thrombosis, embolism, or Raynaud's phenomenon, means there is a spasm of your digital arteries due to exposure to cold, Buerger's disease. Then venous obstruction due to deep vein thrombosis, means plaque formation, solid mass ball formation in the arteries, atherosclerosis condition, arteriosclerosis. Then due to trauma, direct or indirect, due to physical trauma, that is crush injuries, thermochemical change such as burn, scalds. Okay, due to burn, heat, scald formation in that condition also. And if you are suffering from any type of infection such as boils, carbon skull, this may lead to the gangrene. These are the some etiologic or causative factors which are responsible for gangrene. So we'll see what are the types of gangrene. So there are clinically three types of gangrene: dry gangrene, wet gangrene, and gas gangrene. So dry gangrene, in the dry gangrene there is a line of demarcation is present, means the affected part will be dry, shrunken and all this, but a change of color will be there, but living tissue or dead tissue we can differentiate. But in moist gangrene, the line of demarcation means we cannot differentiate. Okay, this part will hold like same. And in dry gangrene we can differentiate between the living tissue and dead tissue. Okay, and in dry gangrene, the gangrenous area primarily not edematous, not infectious, and exposed to evaporation. Okay, so it particularly occurs in toes. And senile gangrene will be the ideal example for the dry gangrene. Okay, then we'll see moist gangrene. And dry gangrene, it is not, means it is not life threatening will be. Okay, so it could not be spreading type of gangrene. Moist gangrene is a spreading type of gangrene in which the primarily the tissues gangrenous area will be the, means there will be offensive smell will be there, but it will be the spreading type. There is no line of demarcation, and this area will be primarily edematous, means swelling. Okay, swelling will present there. Then shriveled, offensive discharge, offensive smell will be there. Sorry. Okay, so this will be spreading type of gangrene. Primarily infectious type of gangrene will be. Ideal example for this is a diabetic gangrene. Intestinal gangrene will also give an ideal picture for this type of gangrene. Gangrene can occur, means early stage will be the ulcer formation. Okay, due to reduced blood supply, this will be strangulated. Okay, due to reduced blood supply, gangrene condition is happening because blood supply is decreasing. Okay, and it getting tissue getting dead and putrefacted with due to bacteria. Okay, so And gas gangrene will be due to the Clostridium tetani bacteria. Okay, bacterial infection will be there, and this gas gangrene will also the form of moist gangrene. Okay, moist gangrene is a spreading type of gangrene, and it is commonly found in diabetic foot. Okay, so their prevention is better than cure, so you should take care of your wound. If you are suffering for diabetics, then take extra care of your wound. Okay, don't get it infected with bacteria. Okay, so the treatment, like we'll see the treatment. Symptomatic and general treatment will be care of the ischemic parts, minor adjunctive surgery, and in surgery the part will be removed. So you should aware that if you are suffering from diabetes, then don't get it infected with your wound. Okay, due to bacteria or any type. Then a minor adjunctive surgery, amputations. So this will be the allopathic treatment, but in the first stage we can cure it, this type of gangrene, by the homeopathy. Before that, we'll see diabetic gangrene. So the three main factors which are responsible for this type diabetic gangrene for in diabetic patient, due to first will be due to trophic changes. Okay, and next, like trophic changes due to peripheral neuritis. Okay, and atherosclerosis due to impaired circulatory function, and decreased resistance of sugar laden tissue to trauma and infection. Means decrease your resistance to trauma and infection, these your sugar laden tissue due to sugar, and sugar will be the very means a good culture medium for the bacteria to grow. Okay, so these three factors will be responsible for these type of diabetic gangrene, diabetic foot, diabetic limb, or that. Okay, so investigation. What should be your investigation? First investigation will be the urine examination for diabetic patient to detect the sugar level. Then next will be the blood examination to detect your serum cholesterol and triglycerides. Then for sugar in blood also. Then state X-ray will be done. Okay, state X-ray. In that X-ray we can see the calcification of big arteries. Okay, so this type of investigation. And ECG. Electrocardiography will be done, and abnormal ECG will be risk factor for your surgery. Okay, abnormal circulatory changes will not be able to, we will not able to do surgery also. Okay, in that condition it will be the life threatening disorder can be proved. So we see the homeopathy. So come to the point, homeopathic management. So first will be the cecal cornutum. There in that patient of the cecal cornutum, there will be a skin become purplish or bluish. Okay, then there will be means gangrene will be of the dry gangrene or senile gangrene. Means dry gangrene, it will not be of spreading type. We can differentiate in that patient which is living tissue and which is dead tissue. Okay, and the patient has sensitive to extreme cold but yet refuse to cover. In that patient will give cecal cornutum, and this is due to the arterial obstruction, indolent violent ulcers there, and arterial obstruction will the cause of this condition. So aggravation by heat and amelioration by the cold, it will be in that present in that patient. So we'll give cecal cornutum to that patient. Will effective remedy prove in the diabetic gangrene also or digangrene also. Then next will be we'll see arsenic album. Arsenic album is an excellent remedy. It can work in gangrene. Okay, so senile and wet gangrene, in that condition we can give arsenic album. In that patient there will be a sign like loss of arterial pulsation or reduced pulsation. Okay, will be seen, loss of temperature will be there. In that condition will give arsenic album. And next medicine like euphorbium. In patients of older age group who are suffering from gangrene like senile gangrene will give the euphorbium. Then next medicine like Crotalus horridus for when the right arm and right limb is infected. In that condition we can give Crotalus horridus. Then Arnica montana. Arnica montana for those patients who are suffering from gangrene but due to trauma or trauma. Okay, only trauma. So traumatic gangrene will give Arnica montana. Next medicine like Carbovage. carbo veg for that patient who are suffering from gangrene, but there is tendency of gangrene to form in the margins of your wound. So in that condition, we'll give carbo vegetables. Then next medicine like bromium. Bromium will also excellent remedy in the homeopathy for control the gangrene or diabetic gangrene, where the gangrene is happen due to the infection. Okay, when gangrene is resulted from the infection, will give that. Okay, and intermittent claudication, we can also prescribe the sickle cornutum in the intermittent claudication, when there is a patient walking some distance and there will be pain in your calf muscles of leg. Okay, so in that condition, we'll give intermittent claudication. So the main signs of your gangrene will be, first will be the loss of arterial pulsation, then loss of temperature, means affected parts will become cold. Okay, it will be cold. Loss of sensation, means hyperanesthesia. Then loss of function, and last sign will be the change of color, means there will be always a change of color from bluish, purplish or blue or cyanous. In carbo veg patient also, the skin, the affected part or gangrenous area become cyanosed or bluish in color. Okay, so these are the very effective remedy like a sickle cornutum, carbo veg, arsenic album, bromium, arnica montana, and also the bromium. These are the some good homeopathic remedies that will cure your gangrene if it is of first stage, and prevent surgery. But if prevention is better than cure, and in diet, if you are suffering from the gangrene, you should avoid the fat-free food. Okay, so this is all about the gangrene or diabetic gangrene. So if you like this video, please like, share and subscribe my channel. Thank you.